morning, everyone, and welcome to our final path day of the spring 2021 semester. And this is the session for Meet the Program and Faculty for Radiography and Diagnostic Sonography. First, I'm happy to introduce Professor Cardillo, who is the Program Director and Professor in Diagnostic Sonography. Good morning.
Good morning, all. Thank you for inviting me today. It's an honor to be with you guys. And I'm excited to share with you about ultrasound. I'm going to go to my shared screen. And let me see how I do this. I hope I can do this right here. And let me pull up. Oh, you know, these old people like me, technically challenged.
You're doing great. We see everything just fine.
Okay. How are we on?
We are.
Oh, excellent. Okay, here we are. So again, welcome. Thank you again for having me here. An overview of sonography. Sonography is also known as ultrasound. A lot of people know it as ultrasound. That's the common day term, but the new term we use now is sonography. Sonography is a unique method of imaging. It uses sound waves instead of using X-ray or contrast. And the good or an advantage to that is that we are not affecting tissue and we're not breaking down tissue. Of course, there are guidelines to use as well, but that is the one good thing, is that we're not using X-rays, but we're using sound waves. And it is actually sound waves that goes into the tissue and is reflected back to what we call the transducer. With ultrasound, we are imaging organs and soft tissue. So we're looking at kidney, liver, thyroid, any soft tissue in the body. And that also includes muscles now. So in the old days, MRI used to be the one thing that was used to look at muscles and muscle tear, etc. But now we have ultrasound, and it's becoming quite an advantage. Again, in using less expensive modalities first, and then going into an MRI if needed. So we have some very good accuracy on that as well. The role of the sonographer. The person performing the exam is called a sonographer. It used to be ultrasonographer, and now it's a sonographer. And the important thing in educating a student in ultrasound is that, or sonography, is knowing the anatomy, the physiology, pathology, and pathophysiology of everything that they're looking at. So let me take for an example, a liver. We need to know the anatomy of the liver. What can happen with the liver? What does it look like? What are the different disease states that happen with the liver? So this happens with every organ that we're looking at. Could be thyroid, et cetera, et cetera. And I'm going to show you some examples in just a little bit. So what makes ultrasound so unique? Well, the physicians that we work with that read our exams rely on the sonographer's findings. We're the detectives. We're looking for disease. We're looking for tumors. We're looking for any cancers in the body. So think about this. We don't have somebody looking over our shoulder. So if the sonographer misses a tumor, then the physician can't report it out, which is not good for the patient. It gives the patient the wrong diagnosis. They might be read out as normal. Patient walks out with a cancer, and it's not a good situation. So this is why there's a great responsibility placed on the sonographer, again, for accuracy. It's vitally important. So what do we do to educate our sonographers? We have our didactics in the classroom. We have the application using laboratory scanning in the school. And then after a couple of semesters, we place you out in the field. This would be in a laboratory. It could be in a hospital. It could be in a clinical lab, so that you have hands-on exposure and training in order to perform the exam. It's one thing to learn it didactically. It's another thing to create it. And I liken ultrasound sometimes to painting, because the transducer is like your paintbrush. You are creating an image, so you need to know the physics behind it. You need to know how to produce an accurate image so that that image is transferred to the physician for an accurate reading. A little bit about the ultrasound program. CCRI, we have an accredited ultrasound program. It is accredited through the Commission of Accreditation of Allied Health and Education Programs, along with JRC, the Joint Commission, Joint Review Committee on Education in Diagnostic Medical Sonography. This is vitally important for our students because unless you are graduating from an accredited institution, you're not able to take the registry exams to become employed. So this is very, very important for wherever you study. And no matter whatever you do, is to make sure that the program is accredited. We are accredited in 3 tracks. These are general, obstetrics and gynecology, echocardiography, and vascular. So what I did is I put a few slides together to show you exactly what ultrasound might look like. So in this situation, this is a gallbladder under the general track, a nice normal gallbladder, and here you have a stone in the gallbladder. So unless you know how to project the sound into the tissue to get this accurate image, this is what makes it a challenge. So that's a gallbladder. Here's a liver and a kidney. So in sonography, we're looking for densities and the differences between tissue. So we see that the liver has a certain normal appearance, and so does the kidney. So when this is off a variation, we know something's wrong. So what we're reporting out is what we see. If we see something that's not right, then that's something we need to flag and take a picture of to show the radiologist. Here's a thyroid in the neck. This is the thyroid here. It's like a bow tie. And just to show you, this is a nodule in a thyroid. So this is something that the doctors might biopsy. We can put what we call color flow or Doppler to see the circulation. When we see this, this might be an indicative of a cancer. So this would need to be biopsied in that situation. Gynecology is our other one, a normal uterus, and we measure it in various planes and look at the ovaries. I'm just giving you a cursory view of what we do, but again, this is all under the general track. Now, this is something everyone is familiar with, obstetrics, babies. This is a first trimester ultrasound of a fetus. This is the second trimester, and this is the third. This is what we call a 3D rendering, and we can actually get the surface rendering of what the baby looks like in utero. So this is what it looks like on ultrasound, and this is what it looks like on 3D. So pretty cool. This is so important because we're able to see a lot of abnormalities that we weren't able to see previously. So it's just enhanced the technology even more. Our next track that we call it is echocardiography, and this is the sonography of the heart. We're able to see the valves of the heart, the various chambers, and we can actually look outside of the chambers into the aortic valves. This is very challenging because we're working around the chest, and these are the areas that we place the transducer to get these great images that we can see. The last track is vascular, and we can look at every vessel practically in the body that is not covered by bone. Well, even in the head, we're starting to be able to see in the brain now. But this is the carotid artery. It's located in the neck. We place a transducer on the neck, and we're able to see it in grayscale. This is a grayscale image, and we're able to use what we call color Doppler. Now, everybody knows color Doppler by the weather report, right? Doppler is showing that the storm is coming in so fast. Well, we're able to see how fast the blood is circulating in the vessel. So this is color Doppler in a medical application. So this has got a little bit of plaque here, and I got this slide because it shows what a carotid artery looks like that has a blockage. So you see a little bit of plaque there, a little bit of plaque here. That little piece of plaque is under real investigation because that type of plaque is the type that can break off and go to the brain and cause a stroke. So this is what vascular does. We also look at veins in vascular, and everybody's heard of deep vein thrombosis, going on a long trip. Make sure you move your legs. That's the other thing that we examine for. Am I going too fast? If anybody has a question, you're welcome to jump in. So let me talk a little bit about the prerequisites for diagnostic medical sonography. It's general admission to the college. Acuplacer test is required unless you have an undergraduate degree. Then it automatically gives you 10 points on the performance-based application. The PSB test is also taken. This is an aptitude test. So these two tests need to be taken before application, as well as these 4 prerequisite classes. So it's English 1010, Math 12, or these 2 maths will be accepted for Math 1200. Physics, which is a general physics class. It's not ultrasound physics, it's general physics. And then biology 1070. So these are the prerequisites for the course. They need to be completed at the time of application. And applications are taken at every February annually. And again, these prerequisites must be completed, the testing, and at that point you can apply in February. And again, this is a performance-based application. So what do I mean by that? Every class that you take is given a point. Every grade is given a number of points. So you get an A, you're going to get the highest number of points. You get an A minus, you're going to get a little less points. So all of these parameters are designated points, and it's based on 100. So here it goes. If you've got all A's, you've got a great chance with a higher score. If you get a great score on your PSB and your Acuplacer, it places you higher on what we call the sort order. So the person with the highest number gets first, and so on down. So getting the best grades is the number one thing I'm trying to get admitted to the program, as well as scoring well on these 2 exams here. Again, if you have an undergraduate degree, then you do not need the Acuplacer. It automatically gives you 10 points. Acceptance notices. The program will usually accept by the end of March, which is now. We have just finished the applications for September. We email our candidates that have been conditionally accepted. And what that means is that that candidate will have to have a background check. They will need to have a physical exam, and they need to have CPR training. So that needs to be complete. And at that point, when all of that has been passed, we give out the formal acceptance letter, and we schedule an orientation so that we can talk with the students, talk with their track desire is, give them more information on the track so that they can make a better informed decision. Any questions so far? I'm almost ready to end. I think this is the last slide. Hope I didn't talk too fast. I do thank you for the opportunity to sharing on Pathways today. And I'm going to put up my information. So again, if you have questions, if you'd like to schedule an appointment, or if you'd like to schedule a virtual appointment, I'd be happy to do that. That's my email. Feel free to contact me. Tell me that in your message to me, tell me that you attended Pathday and that you wanted to meet or schedule a time. And I thank you for your attention.
Okay. Hi, Paula. It's Shannon. I just wanted to let you know you do have a question. So Allie, would you like to unmute yourself and ask Paula a question?
Yes, thank you. Question. How many applicants does the program typically get versus how many students are actually accepted into the program?
Allie, that's a really good question. We had a record number of students this year apply to the program, 126. And we've had only as low as 70 apply to the program. But the number of applicants that we can take range from 18 to 20. That's based on how many clinical spots we have. I cannot admit any more than that unless I have more clinical sites to send the student out for training.
Thank you very much.
You're
And for those clinical sites, are you typically either put in just hospitals or just outpatient facilities, or do you get a mixture and exposure to both?
We have a mixture in all of the tracks, and we make sure that the student has a diversified experience so that they're able to see the clinical practice side and the hospital practice side. So some of the sites, the student will rotate into different sections of that site. So that's worked out with the site itself.
Okay, perfect. Thank you. And lastly, I know that there are prerequisite courses, but I was wondering if there's anything else that would be recommended for potential applicants to do prior to. So is there anything, like, would you recommend shadowing experience or anything like that that would help?
Well, that's always good to shadow. And I'll give you an example. When I started in medicine, in my early days of studying, I was in medical technology and I loved it. But then I was exposed to the possibility of branching into sonography. And so I went into sonography. So it's always good if you can shadow somewhere to see exactly what ultrasound is all about and see how a sonographer works in a day-to-day. That's great. Unfortunately, with COVID, it's very difficult to get into hospitals to observe now because they're very tight regulations. You have to have a check yourself. You have to have a TB check. You have to go through all of that screening process to get in. And because, again, it's so strict right now, it's hard to get into shadow. But if you have that ability to get in to see something, absolutely. No matter what track or what modality or what career you're looking at, it's always good to do a shadowing.
Thank you very much.
You're welcome.
Great, thank you. Does anybody else have any questions for Dr. Cardillo? Okay. Could you stop sharing your screen, please, Dr. Cardillo?
Absolutely.
Thank you.
There we go.
Thank you.
You're welcome.
Okay, great. So I'd next like to introduce, I guess I should share my video. Okay, sorry. I'd like next to introduce Carrie Germano. She is an assistant professor and clinical coordinator for the radiology program at CCRI. She is also a 2004 graduate of our program at CCRI. Welcome, Carrie. You're on mute, just so you know. Okay, nope, still on mute.
Sorry about that. Hi, everybody. Can you hear me?
Yes.
Good afternoon. Hi, everybody. Welcome. Thank you all for having me today. I am, as Shannon said, the Assistant Professor Clinical Coordinator for the Radiography Program. I have been teaching at CCRI since around 2006. And as Shannon mentioned, I am a 2004 graduate of the Radiography Program. So I don't have a slideshow. I mean, Paula did the best on her slideshow, but I'm here to really just answer any questions that you may have. We do have similar admission requirements, just like ultrasound. You have to take your math 1200 class, your English comp 1010, and just an intro to radiography. We are similar to ultrasound, being a performance-based program. We have similar requirements where you apply February 1st, just like ultrasound. It is a 2-year accredited program, similar from JCERT. And we have clinical practice and didactic practice. So anything else, I would just happy to answer any questions you may have.
So why don't I ask you a few questions?
Sure.
So can you tell me what courses do you exactly teach?
We have a range of courses, and it can be looked up on, but do you want to know what I specifically teach?
Like, is there one area that you like?
Yep.
Yep.
So when you get into the program in June, I am your first face you see when you enter the program. I teach the clinical 1010 class. You have 2 classes over the summer, and then after your 6 weeks of education, you go right into the hospital setting for your clinical practice. In the fall, I move over from the positioning part, anatomy part, to the science part. So I'm one of your professors that teach the principles of radiography class. And I also teach in the fall as a second year student your positioning class. And then when you come back into the spring semester, I have a range. I teach the sectional imaging class to prepare you for sectional imaging if that is your choice of modality after you get certified as a radiologic technologist. You can go on and have another year of certification such as MRI, CAT scan. Ultrasound is the only modality that you do not have to be X-ray certified first. But all the other modalities in diagnostic imaging, you have to have an X-ray certification first.
Great. And what drew you to the field of radiology?
Well, to be honest with you, what drew me to the field, I was fascinated with the ultrasound part, Paula. That was what interested me first. Being new mom, newly pregnant, and it fascinated me. So when I researched through CCRI, they told me I had to be X-ray certified first. So I went through the program and I just absolutely loved what I did after. And I never went into another certification because the school had asked me to actually teach. And I was really excited about that. So I have just been, I was a part-time radiographer. I recently gave up that position because I went back to school, and I tell my students never stop learning. I went back to school and actually became a mammographer. So I am not only, I teach you in school, but I also teach, I also am a part-time mammographer.
Great. And so what kind of student do you recommend for your program? Who do you think would excel in this field?
Well, I think any student that has an interest in diagnostic imaging, depending on what certification they want, I think you have to have the drive to study. You have to be willing to study, put in the effort. It is a lot of work, but it is a great field to be into. No matter what modality you go into, it is job security, and the possibilities are endless. So you have to put in the short time sacrifice, I say, for a long-term gain. So someone that is wanting to be dedicated and up on their studies and study and pursue their rest of their education.
Great, thank you for that. Does anybody have any questions for Professor Germano? Okay. All right. So it seems as though maybe we have no questions. So I would like to thank everyone for coming. I'm just going to share my screen here. Sorry about that. I'm not that technology savvy. Hold on. Mm-hmm. Okay, we can all see that. Can we see that?
Yes.
The Pathdays end slide? Okay. All right. So I want to thank you for joining us today. If there's no more questions, I'd also like to just let you know that you can view the recorded sessions here or for any of the other PATH sessions that we had today at ccri.edu/pathways/PathDays, and also to give a shout out to our career or virtual job fair that we're going to have next Thursday virtually, and the link is here, and it will also be on the Pathdays web page as well. I would like to thank both Professor Germano and Dr. Cardillo for their time today, and everyone else who has joined us. Have a good day.
Thank you for having me.
Thank you. Bye-bye.
Bye-bye.
Okay, let's make sure that you're thinking.